morning, and welcome to SMSD Live. My name is David Smith. I'm the Chief Communications Officer for the Shawnee Mission School District, and we're glad to have you with us today. I've got a panel of wonderful folks, and I want to introduce them to you. I want to begin with Elizabeth Holshoe, who's the Population Health Epidemiologist at the Johnson County Department of Health and Environment, where she has worked since 2015. Her primary role is to provide data for program and policy development and to support department activities, including the community health assessment. Welcome, Elizabeth.
Thank you.
Dr. Stanley Ariola is the Director of the Department of Health and Environment. He began this position in March, coming from Nashville, where he was the Deputy Director of Health for the Metro Public Health Department. Thank you for being here, Dr. Ariola.
Thanks for having me.
Dr. Mike Fulton is the Superintendent for the Shawnee Mission School District. He is beginning his third year with the district, and he came to us from the Pattonville School District in the St. Louis area. Dr. Fulton, welcome.
Thank you.
And Shelby Rebeck is our Director of Health Services for the school district. She began as a nurse in the Kansas City metro area 30 years ago and has worked for 15 years in school nursing. Thank you for being here, Shelby.
Thank you, David.
We want much of today's conversation to be in response to questions that you have. We've received your questions over the past couple of days via email, and you can continue to text them to the email address that is going to be on your screen, or you can text your questions to 785-428-0477. Again, that's 785-428-0477. To begin our discussion this morning, I'd like to turn to Dr. Fulton and ask you to give a brief overview of where we are as a school district in relation to the managing of COVID-19.
David, thank you very much, and thank you to those of you that are tuning in. You know, we all recognize the seriousness, scope, and the impact of this pandemic on our lives. We all hope for the swift development of a vaccine. But we also recognize that the COVID-19 could be with us through this school year and beyond. What we've been doing in Shawnee Mission is working hard to develop a strategy whereby we can get students in school and keep them in school for the long term. We want to avoid a situation where we're starting school and then stopping school. So that's why we're working really hard in partnership with the Johnson County Department of Health and Environment to make sure that we are designing up resilient strategies that allow us to do school even as we're dealing with COVID-19 as a society. One of the things that we feel is really important to our long-term success is community partnership. We all recognize the importance of wearing masks and also keeping distance from one another. And I've seen a lot of people out in the community practicing that. But it's also hard to do that day in, day out. We all know that. So we have an important role in our schools to support the community mitigation or help prevent the transference of COVID-19 to the best of our ability. But the schools are just one leg of the proverbial three-legged stool. We can't do it all on our own. We have to do this in collaboration and in partnership with our community as a whole. One of the things that we really learned as a society from the 1918 pandemic is that if you approach solving this problem systemically, that is all parts of the community working together, you can have an impact. But if we approach this problem individually, it will be very difficult to bring rates of COVID-19 transmission under control. And we are doing our part in Shawnee Mission to make sure that we are part of building a systemic response, not just an individual response. And so with that, I'll turn it back over to you, David.
Thank you, Dr. Fulton. Dr. Ariola, you arrived here in March and clearly dove straight into the pandemic. Can you talk a little bit about what that's been like and how the County Department of Health and Environment has been responding to the COVID-19 pandemic?
Thank you, David. Thank you, Dr. Fulton, Shelby. This is a virus unlike any that we have seen. And it's a pandemic that several of us in this field have not seen the like of in terms of magnitude and the things that we have to deal with. The good thing, it's not unique to us in Johnson County. It's the same thing that Nashville is dealing with, and the entire country, as well as other countries in the world. So, but I think it's a challenge that we can face. We do, as a community here, have to have better control over the spread of the virus. In the past 6 weeks, we have just under 6,000 new infections in the county. That's a lot of infections. Elizabeth, staff of the Department of Health and Environment, myself, we want schools to open. Several of our staff have children in school. Sure. They are also impacted. But we also know that to open schools safely, we have to bring the transmission down. Places that have succeeded in opening schools safely have done so when the level of spread is decreasing. Ours is high. Consistently getting 800 plus new infections in a week is a lot. And so we are going to continue to work with our partners. We have worked with the Shawnee Mission School District and several of our districts. And the good thing for us, which again, understanding the work that the districts have done in ensuring the safety of the schools when they open, and that's kind of what we're trying to do. We're trying to keep students in school. We have allocated testing resources to school, and we are getting ready to allocate even more. So the Board of County Commissioners recently, this past week, approved money for saliva tests that we're going to devote exclusively to testing schools. Oh. So we're going to be able to test thousands of students and teachers and staff, and that's a game changer for us. And so we're going to be working with the schools also, not just the logistics of testing, but revising our approach to things now that we can actually test within schools a lot more to get a better picture of what's going on.
That's actually pretty exciting news. I know that's something that there's been a lot of concern about. Can you talk more about when we might expect that to happen, when we might actually see testing happening in the schools?
Well, we're working through a few logistical issues with the local company. We are going to start working with the school nurses and school districts this week. Okay. So this could be available as soon as next week, definitely in the next couple of weeks.
Excellent. Dr. Fulton, I know that's something that you've been concerned about.
You know, before coming in this meeting, I hadn't heard that announcement, so this is really exciting for us. We have been working closely with the county to advocate for increased testing. That really gives us the information that we need to make sure that we're designing up learning approaches that are putting students and staff in the best possible position to conduct learning in ways that make them feel comfortable and allow us to keep ourselves in school, to keep students in school on a regular basis. And so I want to just thank the county for doing that here live in real time, because honestly, the discussions on this have been escalating to the point where we realize without a robust testing strategy, it will be extraordinarily difficult for us to make the kinds of decisions that we need to make that allow us to do our very best to be a partner in stopping the transmission of COVID-19 sure. in our schools and in our communities. So this is a game changer. Thank you.
Thank you. Elizabeth, you're an epidemiologist, so maybe this question's for you, but Dr. Ariola can also join in. There's a lot of questions that have to do with how we know what's really happening in our county. And there are questions about where does the data come from? Does it come from the county or from the state? Questions about whether there's a difference in data between what the state tracks and what the county tracks. But I think all of those questions ultimately come down to what do we use and how do we know what's really going on? So can you talk about the data you use and the decisions you're making with it?
Absolutely, David. Thank you for the question. So there have been a lot of questions about the data that we're posting on our dashboard that we've been doing really since March, and what some of the data that KDHE has been posting, and where those differences come from. And the reality is it's the way that we look at that data, right? So in Johnson County, because it's our county, we have a more granular view of what's going on. So we have a better understanding of who's being tested, how many times they've been tested. And what we know is we have a number of individuals in our community who are tested multiple times, right? We have people who are associated with professional sports who maybe are getting tested every day or every other day. So they have a lot of tests. Some people who've been tested over 50 times, really in the last couple of months. So what we've done in Johnson County is really look at the individuals who have been tested as opposed to the total number of tests. Another piece that goes into this is our long-term care facilities. So we know, particularly at the beginning of this pandemic and really throughout, we've seen some long-term care facilities, our nursing homes, have outbreaks. And when that happens, we test those nursing homes every week, every single resident, every single staff member. So if you think about that, you may have a facility that has 200 or 300 people who are having to get tested every week. And so if you keep that and that total number of tests, it can deflate. It can cause that percent positive, which is the big metric that we're looking at, to go down. Now, even though our data are different than what KDHE is posting, the reality is if you look at the trends over time, those trends are really consistent. It's going up or it's going down or it's staying stable, and really in terms of our percent positive, we've really seen the stabilization of that, where we've been hovering around 10.5%, the way that we calculate it. But I think even beyond that, we look at cases as well. Like, it's not just a single metric. If you've gone to our dashboard, jocogov.org/coronavirus, and click to our dashboard, we have a lot of data. We have tried to provide as much information to our community because we understand that our community members are intelligent, engaged, they want to know the details. And so you can go and get a wealth of information. So for us, it's not just the percent positive that we're looking at. We're also looking at the number of new cases. And you heard Dr. Ariola say that over the last 6 weeks, we've had 6,000 cases out of our little more than 8,000 cases that we've had total since March. That's a lot. So we're really looking at the trends over time. We're looking at how that's moving. We're looking at what direction we're going for not just percent positive, but a number of metrics, including the number of cases we have per 100,000 population. So that's sort of generalized to the population. So there is a wealth of information, but really it comes down to just the way that we look at data and really understand data. And because we're local, we have a better understanding of what goes on in our community, which allows us to really analyze that in a different way that we think is a more valuable way for our community members and to interpret what we're seeing.
Sure. So just so that I'm clear, and so we make sure the audience is clear then, those questions about the testing and the numbers we use, one of the concerns was, well, they test some people a lot, and does that change the data? What you're saying is you take all of those things into account and use that information in terms of coming up with the the number that we've been at.
Absolutely. So yeah, we look at the number of individuals who have been tested as opposed to just the total number of tests. And that's what KDHE does. They're looking at the total number of tests. So they're counting that person who's been tested 50 times in that denominator, in sort of that bottom number that you're dividing it by.
That means it's going to be a lower percentage than what we have in our county.
Absolutely.
Okay, that makes sense. Yeah. So, and then also to be clear, and this is for both of you then, we're not in a good place as a county in terms of where we are case-wise. Is that correct?
Yeah, so first of all, to add to, I know that Elizabeth and her team are looking into just to bridge the gaps between how people see our data and how they see the KDHE data. We're looking at presenting the positivity rate and data in multiple formats on our dashboard. So you'll be able to see that. But that goes to your key question, is for us, the primary consideration is stopping and containing the spread of the virus.
Right.
So if you don't fully understand or agree with positivity rate, you can look at the case count, the rate per 100,000 residents. That's pretty high.
Because that's over 100, right?
Yes. Or you can look at the absolute count per week or per day. So if we are getting 116 new infections every day, that is a lot.
Right.
And we're not counting positives from people multiple times. These are new infections in different people.
Okay.
So we do have to break that transmission. 6,000 new cases in 6 weeks, 116 cases a day, over 800 cases in a week. That's a lot of cases here. But we also know that even though the virus is new, we know that there are things that are proven to work.
Right.
And so I personally would like to see that the parents that are looking for their children to participate in extracurricular activities are wearing masks. So when I get emails from people that are asking questions about getting criteria and challenging why we are not letting kids play, and in the same email, I am seeing that they say, hey, masks don't work, we don't need to wear masks, open things up. Those messages don't agree. We have to, out of responsibility to the community, all work together, wear masks. Stay away from crowded bars and restaurants. Stay away from crowded events. If we do that, we bring the numbers down, and we can safely open our schools with minimal restrictions.
So to emphasize that point again, you're saying masks do work.
Absolutely. Mask is by far the best tool that we have available for us, short of shutting things down and sheltering in place, which we don't want to go back to because of the consequences on economy and other stuff. Right now, mask is the most effective, easily done tool that's available to us to bring the numbers down.
And then one question that comes up, and we just came in again, is that question of, well, we're testing more, so of course we're finding more cases. How do you respond to that?
Okay, so there are two things there. So we are also getting, you're only testing sick people. If you test people that are not sick, you won't find the case. Let me just put it this way. If you are not infected, if we test you, you will not test positive.
Right.
So the virus is going around.
Right.
These are new infections in new people that we are picking up daily and every week. The numbers are high, and back in May, our positivity rate was below 2%. We were testing, maybe not as much, but we were testing a lot.
Right.
We had drive-through events where we tested over 1,000 people and only picked up a few cases. So if the infections are not there, trust me, the test will not pick it up.
And
Go ahead.
and if I can, I think the important thing too is we need to find these cases, right? These individuals are people who are positive for the virus and can be spreading it throughout our community. And so the really big piece of this is the public health component, which is we try and call them, inform them of their positive lab result, get information, and then reach out to their contacts to make sure that they don't go on to spread the disease.
Sure.
The thing we know about this is it rises in an exponential form. So one person can infect 2 people, who can then infect 4, who can then infect 8. And if we can't stop that from the public health perspective, our growth is just going to continue to increase. So we need to be testing. We need to find those positives so that public health can do its job to try and slow that spread.
So one of the things I've heard in relating to the exponential growth is that you want to keep the transmission for one person to another below 1, because then the numbers will go down. If it's above 1, it's going to grow and grow and grow. Can you talk a little bit more about that?
You're absolutely correct, David. We need to break what we call the transmission chains, right? So if I'm infected, we need to try and prevent me from infecting you, because maybe you live at home with somebody with a pre-existing condition. So the way we do that is through tried and true public health measures, case investigation, contact tracing. And so this is what the health department has been doing, not only since March in the pandemic, but really for a lot of public health history and a lot of various diseases. And so it is really important that we do this public health work. And part of the issue with the number of cases is we need to make sure that the public health workforce in our county can keep up with that. Because if we fall behind, if we're not able to reach out to every case or every contact, then we then will start seeing that exponential growth, and we can't keep that number to less than 1.
Sure. And can you talk about the other institutions in the county with whom you work, and not just in our county? We have Children's Mercy, we've got KU Med Center. How do you all collaborate with those entities in terms of your work?
So public health is really about partnership. It's about collaboration. There's a lot of things that impact health that we don't necessarily control. And so we rely on relationships. We have worked, Elizabeth has championed a lot of the work with the Children's Mercy, with KU, medical staff, personnel. In fact, our local health officer also work there. So with other counties around this region, that's very important because we don't have walls around our counties. So there's a lot of people that work here and live in other counties and vice versa. And so it's impossible for us to drive down our numbers if we don't work with surrounding counties. And we're doing that. We are going to continue to work with local organizations that have built relationship with the community that people trust. That's what's going on. One of what I think is the biggest challenges. It's a lot of misinformation out there. Yes. There are people that are creating graphs and presenting those in ways that if you know anything about data and public health, they're really not credible at all. Sure. But then if you don't know, you look at them and you say, oh, so for example, there are graphs circulating saying masks don't work. That's a lie. So we had to spend time. So we had to spend time creating graphs from data just to show that that's inaccurate.
Okay.
There are graphs out there talking about mortality rate is declining. Right. That's also inaccurate because there are they're mixing up what we call case fatality rate with what we call mortality rate. So case fatality rate is typically a number of cases as the denominator and then number of deaths as the numerator. Death cases that die. Right. Mortality rate is typically calculated as per 100,000 residents. So as long as you're having death, mortality, and your denominator doesn't change, it will go up. Sure. So if you're giving me a graph as a percentage and you say it's coming down, I know you don't know the technical differences between those. So those are inaccurate. You can disagree with some of our data, you can ask questions, but it's better to go to the source to get those data. And so my point is, to get our information out to the community, we need to work with school districts. We need to work with the chamber. We need to work with community organization, Children's Mercy, and that's what we're going to continue to do.
Excellent. I'm going to turn and direct some questions to the district. Dr. Fulton, Ms. Rebeck, a lot of parents want to know, if my child has symptoms or a positive test, what do I do? Whom do I contact? Do I call the school nurse? Do I call the school office? Do I do the attendance line? How am I supposed to respond as a parent?
Yeah, this is a question we're getting a lot, David. And so there's really two avenues that the school is going to find out. The first would be that the parent calls the attendance line and says, hey, my child is sick. We would really like that parent to speak with the school nurse so that she can go through those signs and symptoms of COVID to kind of guide that parent to, is this something that is normal for your kiddo? Does your kiddo have allergies or asthma that may be attributed to these symptoms? Or are these new and different signs and symptoms that possibly we could be looking at a case of COVID? So the school nurse is really important to speak to if you're calling in through the attendance line. The other way this could happen is a student could be in school and not feeling well. And so the teacher would send the student to the nurse. The nurse would assess that student, again, asking those same questions related to COVID, contact a parent, get some information from the parent. And then if it's determined that this is a possible COVID case, we have a special room that we will allow the child to wait while we call their parent, and their parent comes and picks them up.
And that special room is an isolation room, right?
Yeah, and we're calling it a care room. We don't want to use any scary terms for our youngest.
I love scary terms.
Yeah, but you know, the thing is we have worked in partnership with the County Health Department and Children's Mercy to develop the isolation and quarantine protocols that all school districts in the county are following.
Excellent. So then what happens if, for example, I have a child and a classmate of that child tests positive? What do I do? Do I quarantine my child for 10 days or for 14 days? And how do I know?
Another really good question. So as Dr. Ariola pointed out, masking is so important. And here in Johnson County, the county has advised us if all parties are masked appropriately, then no quarantine is going to be necessary. Now, If we find that we have more than one case in what we call a cohort or a small group, so kids that ride the bus together, kids that are in after-school activities together, kids that sit together at lunch or play together at recess, if we find 2 cases in a cohort, then we'll be contacting the county to help us with an investigation to determine, were those kids exposed outside of school and really are completely unrelated?
Sure.
Or is this transmission that we're seeing within our school, within our classroom?
Okay.
So it wouldn't necessarily be required for a 14-day quarantine if everybody is masked properly.
And then if we have a case in the school, either amongst a student or a staff member, what about notification?
Shawnee Mission School District will be notifying you if there's a case. But what we will likely be telling you, hopefully be telling you, is that because you took the appropriate mitigation measures, because our district is requiring people to wear masks, because we're cohorting, because we're 6 feet social distancing in our classrooms, because of all these reasons, you and your classroom will not have to quarantine.
Okay. Dr. Fulton, there's been conversation about if we're going to change gating criteria and move from remote to in-person or hybrid, that there's going to be a 14-day period. Can you talk about that and how it is that we make that move?
Sure. The county regularly provides us with updates on where we are in terms of what gating criteria in red, yellow, or green. We use that information then to make decisions about proper instructional placement. When we get that information from the county, what we've committed to is providing a minimum 14-day window before we move from one mode of instruction to another. That's important, because if you're a parent, you have to plan your life schedule. And so we want to make sure and give our parents time to make that transition. And for our staff, they're also making a transition. So they need time to prepare their students to go either from in-person learning or to remote, depending on what direction you're going.
Sure.
So that's why you have a minimum 14-day window.
Pam Lewis has joined us. Pam is our Director of Elementary Services, I believe. Pam, can you talk a little bit about the different modes of instruction? I think there are a lot of parents and children who don't understand what it means to work in a remote environment or in a hybrid environment. So can you take us through and give us a picture of what that looks like?
Absolutely. And right now we have our schools reaching out to our families this week and our students and sending out introduction videos, sending out more information about how to access Canvas, which is our learning platform that we're utilizing for all of our students pre-K through 12, and just a lot about what your schedule might look like and all of those beginning of the year introductions. But if I'm a student in a remote model, I'm going to have a schedule just like I do every single day when I go on site to school. And if I'm on site in that hybrid model, that schedule is going to be consistent with what it looks like when I'm in the remote model. So students will have that consistency. So for example, I'll start my morning with my morning meeting, and that's going to connect me with my classmates and my teacher. We'll work on some social emotional skills and some relationship building skills, and that also helps the teacher have that opportunity to set the stage for the day. This is what's happening throughout the day. This is what reading's going to look like. This is what math's going to look like. You're going to be following your choice board with social studies. Let's talk about what some of those activities are that you can choose from. Students will have recess, students will have lunchtime, students will have specials. One thing that we have set up that I think will help with the consistency for families is that at the beginning of the week, of this first week of school, we're going to have an ABCD schedule. So students can get introduced to the art teacher, the music teacher, PE, librarian, and then we'll go on a weekly rotation.
Okay.
So that allows a parent to know my child will be having art for specials all week. The teacher's going to let me know what supplies we need to have, the space we need to have, so that that's where we focus our instruction for specials, where the next week may be library or music. So we're hoping that that will help with families and that consistency as well.
Okay. And then in the hybrid, tell us how that then changes what you just described.
Well, in the hybrid model, if I'm on site, I'm coming on site, and I think that's one great thing about the remote is teachers are going to be able to prepare students for what school looks like. Because while there will be a lot of similarities, there will be a lot of differences. And so when students come on site, you might be coming in a different door than you used to come in, one that's closer to your classroom. You will have some visuals on in the hallway to help with directional flow. Recess will be a little bit different. You're going to have different stations that you participate in with the classmates in your class, so we keep that cohort together. So some of those different aspects of school we'll be able to pre-teach, but we'll definitely be following that same instructional model. So I may be teaching live instruction for math with my entire class, and then if you're in the hybrid model at home, then you would maybe move into the Zern online platform, while the students in school had small group instruction from the teacher.
So it sounds like there's going to be a fair amount of instruction happening to help kids to transition from one mode to the next. I mean, I imagine things like wearing masks and going to the bathroom and all of those things that are regular parts of our day. Can you talk a little bit about how we're going to help our children to learn those things?
Yes, I think that's one of the other great things about starting with the remote. We can start building some of that mask stamina, because it's difficult, even as adults, when we've been home, working from home, and then you come on site and you're wearing a mask for 8 hours a day, and it's going to be challenging for students. So just practicing that with, we're going to have math, we're going to set the timer for 10 minutes, and we're going to have our masks on for 10 minutes of math time, even if you're learning remotely.
Sure.
Then we're going to take our break. And when we're at school, we'll be wearing our masks in the classroom. We're probably going to be going out for a walk break, because when we're outside taking a walk break, we can then take a mask break.
Right.
We would have our masks off when we're in the cafeteria eating lunch. But again, our principals are working with staff to strategically place tables, have seating, so that it's a safe environment in the cafeteria when we are eating lunch and don't have our masks on.
So for example, in the cafeteria, we would expect that the tables would be, kids would be sitting 6 feet apart so that they are socially distanced.
Yes, if you walk into our cafeterias right now, we have a lot of tables set up to where the tables are spread out. There are visuals on the tables so students know where they will sit. The students are all facing one direction. We're utilizing stage areas. We've extended our lunch time, and we may be utilizing some other spaces in the school as well.
Gotcha. That's really helpful. Thank you. Dr. Fulton, one of the questions that a lot of people have had, we're different here in Shawnee Mission in that in our elementary schools, we go through 6th grade. Because of our conversations with the County Department of Health and Environment, we're treating our 6th graders differently. Can you talk a little bit about that and that decision, and maybe we'll bring the county in as well?
Absolutely. You know, one thing that is, as you mentioned, that's different about Shawnee Mission is that we have grades pre-K through 6 in our elementary schools. Everyone else in Johnson County is either goes up to 4th grade or 5th grade. We committed from the very beginning to a science-based approach to decision making. And we also recognize that our understanding of COVID-19 is evolving. And so as more studies are produced, our understanding of COVID-19 grows. But one of the things that we're really looking carefully at is, what is the right approach? What is the right age or age range at which it's appropriate to bring students into a school setting? And can we set up the conditions where we have students in school to make sure that all students are attending school in the safest possible way that we can set it up? Let me just talk about safety for a second before we explore this age piece a bit more. When we talk about safety in a COVID-19 world, we know that there is probably not going to be opportunity until there's a vaccine to bring that down to 0. There are going to be transmissions. We are talking with safety about putting into place all of the possible precautions that we can to reduce the risk of transfer as much as possible. That is what we're committed to doing. Pam just laid out a strategy for why we're starting remote. Then we're going to move to hybrid. We've never run school in a COVID-19 world before. There's a lot of learning to do. And so we're going to take this slow, methodical, and eventually get to the point where we reach our end goal, which is having all students in school. But again, with all of the protocols in place that are necessary to reduce the risk as much as possible. And so then if you turn over to the county and talk about some of the science behind this a little bit.
Yeah, so this has come up a lot, particularly because Shawnee Mission School District does have K through 6. And really what we're basing this sort of 10 and under piece on is there have been a number of studies that have shown that it appears as though kids, younger children, those under 10, are less likely to transmit the virus. They can become infected. They can have symptoms, but usually those symptoms are a lot milder. And there have been other studies that have shown that they do have quite a bit of virus in their nose and in their throat. So they do have the potential to spread it. But because maybe they don't have as many symptoms, they're not coughing as much or sneezing as much, the virus has less of an opportunity to go from that child to another child.